My periods are very irregular. How do I know if I'm ovulating? I don't want to go to the hospital for many tests. Can I find out at home if I'm ovulating? I have PCOS. I don't get my periods for weeks. How can I conceive fast? Ovulation kits and period tracker apps are also not very reliable. How can I know at home about my fertile days? So, whether you are planning to conceive or trying to avoid a pregnancy or just want to better understand your body, this video is for you. So, hello everyone, I'm Dr. Anjali Kumar. I once again welcome you to Maitri. Maitri is a space where we talk anything and everything about women's health. So stay tuned as I will not only explain these signs, but I'll also give you tips to track ovulation more effectively. So let's get started. So first, let's understand what is ovulation. Ovulation is an event which happens when a mature egg is released from one of your ovaries. Now, this usually occurs around the middle of your menstrual cycle, but the exact timing can vary depending on the length of your cycle. Ovulation typically happens 14 days before the next periods. So in a 28-day cycle, the ovulation will happen on day 14, while in a 30-day cycle, it will happen on day 16, and in a 35-day cycle, it will happen on day 21. Always remember, we count day 1 as the day when your periods start. So now let's dive into the signs and symptoms of ovulation you should look out for. First, change in the cervical mucus. So around ovulation, your body produces more cervical mucus and its texture changes to become clear, slippery and stretchy, something like a raw egg white. Now this is known as spin barkite phenomena. This mucus helps the sperm to swim easily to meet the egg. And if you notice this change, it's a sign that you are in your fertile window. So observe changes in your cervical mucus throughout your cycle and you will not miss that raw egg, stretchy consistency of your cervical mucus. Mild pelvic pain. Now this is also known as, it's got a fancy name, little smurs. Some women feel a mild one-sided pain in their lower abdomen during ovulation, depending upon whether it is the right-sided or left-sided ovulation. Now, this is called mitral smurs and it happens when the follicle releases the egg. Now, this is usually harmless, lasts for just about few minutes to maybe few hours. But in case the pain is severe, you should immediately consult your doctor. Breast tenderness or sensitivity. After ovulation, progesterone levels in the blood increase, which can cause breast tenderness or sensitivity. Now, this is a normal symptom, but in case it's persistent or painful, it's worth discussing with your doctor. Then, increased basal body temperature. So, after ovulation, your basal body temperature rises slightly due to progesterone. Now, tracking your basal body temperature daily and noting the temperature shift can confirm the ovulation. And nowadays, we have specific BBT thermometers available to record this accurately. Now, let's understand how to do this exactly at home. So, take your temperature every morning before getting out of bed to observe the post-ovulation temperature rise. Post-ovulation, there is usually a rise of 0.5 degrees Celsius, which persists till your next periods. How to do this? Take a BBT thermometer. It's a special kind of a thermometer. It's more accurate. Take the temperature upon rising from the bed first thing in the morning without even rinsing your mouth. Take it the same time every morning, ideally after at least 3 to 4 hours of uninterrupted sleep. Avoid alcohol, stress, or any illness. These can affect your readings. You can record your temperature orally, vaginally, or even rectally. Record the temperature on a chart, app, or a notebook. Before ovulation, the BBT will be lower, somewhere between 97 to 97.7 Fahrenheit. After ovulation, BBT will rise by about 0.5 to 1 degree Fahrenheit and will stay elevated until your next period. If pregnant, BBT will remain elevated beyond the expected time of your period also. Then, increased libido. During ovulation, many women experience a boost in their sex drive. Now, this is your body's natural way of encouraging conception during the fertile window. Some women notice light spotting or a pinkish discharge during ovulation. Now, this happens when the follicle ruptures to release the egg. But in case the bleeding is heavy or it lasts long, you must definitely consult your doctor. Then, heightened sense of smell. Your sense of smell might become sharper around the ovulation because of hormonal changes. You may be more sensitive to certain scents, especially pheromones. Once again, it is the nature's way of encouraging the conception. Then, mood changes and energy levels. You may feel more energetic, confident, or even more emotional around ovulation. This is due to a surge in hormones like estrogen. These mood and energy changes are natural, but of course can vary for everyone. Then, fuller and glowing skin. Now, this is something which every woman wants. So, some women notice that their skin appears healthier and more radiant around the ovulation time. This happens due to increased estrogen, which boosts the blood circulation and gives your skin that healthy glow. Cervical position changes. Now, during ovulation, your cervix, which is the lowest part of your uterus, moves higher and becomes softer and more open, once again to facilitate the entry of the sperm. While this isn't something which you can feel easily on your own, but your doctor can definitely check it during a fertility evaluation. Nowadays, we have cycle tracking apps also. You can use them. They may not be very accurate each time, but you can definitely take a look at them. Ultrasound monitoring. In some cases, your doctor may recommend follicular study or ovulation study to pinpoint ovulation with precision. So the most important thing when planning a pregnancy or even avoiding a pregnancy is the timing. Understanding ovulation is key to understanding your fertility and overall health. So if you are trying to conceive or have concerns about your cycle, these signs are a great starting point. However, if you're not sure or have irregular cycles, do not hesitate to reach out to your personal gynecologist for a personalized advice. So thank you for joining me today. If you found this video helpful, please give it a thumbs up, share it with someone who might benefit, and do not forget to subscribe to our channel Maitri for more women's health tips. Take care, and I will see you next time.